Hi, Dr. Sandeep. In case of strong family history of breast cancer, what should one do?
Yes, breast cancer can run in families, what we call as hereditary cancers. But it is only 5 to 10% of breast cancers that are familial. So most of the breast cancers are not linked to family at all. But whenever there is a clustering of cases, which means there are multiple people in your family with cancers, you need to raise a suspicion. It's not one single patient, it is multiple people. Like at least two people with breast cancer or ovarian cancer or prostate cancer. So any cancer, but at least two people with cancers, if they are there in the family, it is a warning sign. Very often, what I have noticed is that when a patient comes to me or a worried person comes to me because of family history of cancer, they would have done erratic investigations. Erratic in the sense they would have done random investigations which are meant to be done only after diagnosis of cancer is done. They are not meant to prevent anything, they are not meant to do early diagnosis. So most of the times the systematic evaluation of these patients or people with high risk is missed, even by doctors for that matter. So what is the right way to look at the problem? Because when we have a person with a high risk of cancer, our intention is to reduce the risk. It is not that we want to diagnose the cancer. We want to reduce the risk. We want to prevent the cancer from coming. So how can we do that? We need to look at whether there is a true genetic component. Today, we have tests available for that. These are called germline mutation tests. These are also known as multi-gene panels. They look at those genetic or DNA damages which can lead to breast cancer or any other cancer for that matter, and tell us if that given person has a higher risk or not. So if we know that you have a risk of breast cancer, there are specific things that we can advise for you. There are things like a surgery which can be advocated for prevention of breast cancer and ovarian cancer, which go together by the by. There is a gene called BRCA gene, BRCA1 and BRCA2, which lead to both these cancers, ovarian cancer and breast cancer. So there are surgeries which can prevent occurrence of breast cancer. At the same time, there are some medicines which can be given which will reduce the risk of breast cancer. So there are many things which are possible to do which will avoid or prevent you from having cancer. But that has to be done systematically. So the key is to do a germline mutation testing. That test will tell us whether you have a higher risk or not. There are many other things. Once you are diagnosed with a genetic mutation, there is a systematic evaluation that is required for you. There is a preventive program in which we will be putting you so that your risk comes down. No erratic investigation will solve your problem. So whenever you suspect that you are at a higher risk, approach an oncologist. Go into a systematic or planned program to avoid you from getting cancer. That is the most important thing.